is probe placement. People do not place the probe on the anterior margin of the lateral malleolus. They don't put it on the anterior margin of that bony prominence of the distal fibula, which is the lateral malleolus. So make sure the probe is obliquely placed on the front margin of that bony bump that you palpate on everybody's ankle. And then you have to have it obliquely oriented like you see here in the photograph. It's nice to have the patient kind of roll up on their side a bit to expose the lateral ankle, but you don't have to do that. But it is the talofibular ligament. So this is the talus, this is the fibula. So the ligament is going from this bone to this bone, and it should be seen when it's normal, because we're always talking normal anatomy here, a fairly well-described ligament that goes between the two bones. There are times, it's good to remember also that the ligament interdigitates, it blends with the deeper anterior joint capsule, and you may get this kind of filling of the joint space, even in a patient that hasn't experienced that common ankle inversion, roll the ankle under type of injury. So that doesn't mean that it's abnormal just because the joint space is filled up, but do your best to evaluate this ligament in this orientation. Again, don't forget that it's we're using real-time imaging, and we can apply that inversion stress to look at any type of defects we may see in this ligament.